Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I'm here with Dr. Sophia Thomas, a family and pediatric nurse practitioner at the DePaul Community Health Center in New Orleans, and she is the president of the American Association of Nurse Practitioners. Dr. Thomas, thank you for taking the time to be with me today.
Oh, I'm happy to be here. Thank you.
And Dr. Thomas, our world continues to rapidly change. Over the last 5 months, we have been on a roller coaster from a pandemic to an economic crisis to really highlighting the issues around disparity and racism and inequity. And as nurses and leaders, people often look to us for guidance. What thoughts and insights can you share on how we can show up as our best selves every day, and how can we help to make the world a better place?
Well, that's a great question. And, you mentioned showing up every day, being our best selves. We can't change the past, but we can define our future. Every day is a new day. And I think, on a personal level, I would say it's important for people to listen and be a good neighbor and, follow the golden rule and all those things that we were taught as children. Listen more than we speak. You can learn a lot about a person just by listening. And mentor others, bring up others behind you. Mentorship is so important, not only in the medical field, but in every field. People with experience take somebody else under their wing and help bring them up. I think it's also important that we advocate for the voiceless. As nurses, nurse practitioners, many times we're advocating on behalf of patients, speaking up for what is right for them. And I think that should go across all lines, all professions. It's important to advocate for the voiceless, advocate for those who have needs. At AANP, we think it's important to listen to our grassroots nurse practitioners, hear what they're saying, hear what their concerns are. And so certainly we do that on a daily basis. It's also important to respond. So not only listen to what the needs are, but respond and engage and help develop and design programs to meet the needs of our patients as well as our nurse practitioners. And I think it's also, when you talk about on a daily basis, what can you do to be your best self? Always recognize the little things in people. It never hurts to pay it forward, pay a compliment. You never know when someone's having a bad day. I often tell my office staff, if somebody comes up to the window and they're rude, you don't know what kind of experience they just had. So always be your best self and model good behavior and model professionalism. And I think that can be infectious.
I love the pay it forward and speak for those that don't have a voice, because it's so important. And I think we take these things for granted. And, many of us are very fortunate, and I dare even say privileged in our daily lives and what we do. So thinking about the empathy that's involved in every conversation is one of the things that I think makes us different as nurses. So I love your message. It really resonates with me. Thank you for sharing that.
Thank you.
And where can people find you on social media?
So on social media, you can find me at AANP News or AANP.org or AANP President.
And you have an assistant who's telling you it's almost time to go.
I do. I have my lovely golden doodles.
Awesome. Awesome. Well, thank you again. And I am Dr. Bonnie Clipper. And remember, at Wambi, moments move us.